Well, good afternoon, everyone. Thank you so much for joining me for this next hour. And I am grateful for your time and attention in this kind of odd time of history. A few little sort of housekeeping matters. There is a little chance for you to send me a question along the way, and I do promise to get to them all at the end of this webinar. So the title of my webinar today is Making the Changes Now to Reduce Patient Visits in 2020. It's been on my mind a fair bit because, well, obviously I've had lots of time to think, but also kind of thinking about going forward, how we can serve our patients well, but perhaps not see them quite as often, but still provide a high quality of care and great results. So that's what we're all about today. And again, I'm grateful for your presence. I am Bruce McFarland. I am a wet-fingered orthodontist, and I'm a diplomate of the American Board, a fellow of the Royal College of Dentists of Canada. I'm a fellow of Pierre Fauchard Academy, and I am a Menson, if you want to look that up. I was an assistant professor at the University of Manitoba in graduate orthodontics, and been working lots with clear aligner companies for a long time. And I have been an educator for them. I'm also an educator for Henry Schein Orthodontics and a key opinion leader and educator for Propel Orthodontics as well. And I have my own little company, which I'm going to share with you. If you wish, I can help you out along the way. And it's called I Can Do Orthodontics. I have 3 offices offering specialty orthodontics in Manitoba, Canada, and 2 in Ontario, Canada. And the 2 in Ontario are aligner-only offices. So another motivation for me to not quite have to see my patients quite so often, but still, of course, provide great service and do a fantastic job. Usual disclosures, I'm not employed by any dental company. I don't own any stock, nor do any of my family members. But as mentioned, I have been a key opinion leader for Propel, for Henry Schein Orthodontics, for Serum Orthodontics, their Canadian subsidiary, and for Align Technology. And I have been compensated in the past, and I will be compensated for this today. So it's important for me to share that with you, but also assure you that I will tell you the truth. And here we go. I bring you greetings from Winnipeg. Been a little slow this year getting spring going, which has helped us to do a good job with social distancing because no one wants to go outside anyway. However, when spring and summer finally come, it's going to be great in Winnipeg. I mentioned to you I have 3 offices. One of them is sort of a very typical ortho office with lots of chairs and lots of people. And I do a lot of braces and aligners in that office. My second office in Thunder Bay, Ontario is geared much more towards aligners. And I have 3 team members there. And I'm very lucky to have them on the ground and helping me out. And my third office is in Kenora, Ontario, which is on Lake of the Woods, which a lot of you may know as one of the most fabulous lakes in the Canadian Shield. And I have 1 person who works for me there. We're looking forward to summer on Lake of the Woods, and you'll see why I like to have an office there. And the office is a bit distracting because the windows overlook the lake. So you can imagine with all of this, I want to find ways to minimize patient visits, but still keep cases on track and make sure that I'm doing a great job and providing excellent service and great results. So once again, I've had time to think about this, and I've been a bit analytical about it as well. And we're very aware of chair time being money. This CPA, some of you may have one of these guys, has a very annoying grasp on reality. And he stated that absolutely every time someone sits in one of my chairs, with rent, salaries, PPP, and that's going to be more, I think, going forward, heat, light, water, insurance, maintenance, capital cost allowance, taxes, all of those things that he loves to talk about that I don't. It costs me about $110 before I even say hello to people. So obviously, over the course of a treatment time, I am actually quite motivated to see my patients less. And yes, my CPA is annoying, but he tells me that every extra visit cuts into the profit for that case. So therefore, I am motivated to minimize the number of times a patient sits in the chair. And on the other side of it, our patients actually very busy. And despite the fact that we know absolutely that they love you and they love to come see you, their lives are crazy. And if you look at the life of an average mom or a dad that is trying to keep everything together for their families, believe it or not, orthodontics may be a bit down the list for them. So the fewer times that they can see you and still realize an excellent result, the better. So we need ways to make sure that our cases are going to track and that our well thought out plans are coming to fruition without a lot of extra visits for braces and for clear aligner patients. So the question is, okay, how can we do that? And the answers are micro-osteoperforation and high frequency vibration. And been using these techniques now for about 7 years in my offices. And we've had such terrific success that they've really become quite routine, both proactively, meaning that we think about it in advance for cases that in particular really want to go fast, and reactively, and in cases where I haven't really anticipated all of the possible troublesome things that might occur, and they do occur. So it's also neat to have this in my back pocket for those sorts of cases as well. So what do we have? On the micro-osteoperforation side, we have a manual driver, which was the first, there's sort of one original generation, which was a manual driver that didn't look quite like that. This is a second generation manual driver, and then of course there's a rotary driver as well. And then the high frequency device as well. And on almost all of our cases where we're using micro-osteoperforation these days, we also use high frequency vibration. Now right away people are going, okay, gosh, that sounds like some extra expense. And the answer is yes. And in proactive cases, we generally charge about what these devices cost me. The proprietary burr and the device, the high frequency device as well, are in around $500 or so. So we try and pass that along to our patients. There's actually code in the fee guide for the micro-osteoperforation, but not much beyond that. And so basically I would just like to get reimbursed for the cost of these devices, but I know of the economics of making things happen much more assuredly and faster and with fewer visits. And those are where the economics of all of this shines. So we actually don't necessarily make money on these devices. We make money on all of the things that they allow us to do more efficiently, faster, and with less visits. So in our office, acceleration itself with micro-osteoperforation and high frequency vibration is very routine. And you'll know what I mean when we get a few brides to be, and on their list, of course, is straight teeth, and they forget that that takes time, and they come and see me at about 6 months out and say, okay, here's my malocclusion, and I go, okay. And they go, here's my timeline, okay. And I want to be out in time for my wedding, and I need time to hold, and I want you to smooth all my teeth, and I want you to whiten them too. So we've got all of these things on these lists, and I'm generally afraid of brides anyway, and also brides' mothers. So I'm very interested in finding ways to make that happen. This lady, Amanda, is an example of proactive acceleration that we used in the office. She wasn't getting married, but she was in a hurry. She's a busy mom. She loved me, but didn't necessarily want to see me all that much. And she wanted this to happen fast. Class 1 relapse, as mentioned, there's millions of these cases out there. They blame themselves, of course. Didn't wear my retainer as a kid. And I go, yep, yep, yep. My wisdom teeth came in and push my teeth around. Yep, yep, yep. Good, good. Just nod and wave. And then they'll say, okay, is there a way to fix this? And by the way, I want this done as fast as the technology will allow. So here we go. This is Amanda. She's going to have 18 aligners and pretty routine. We use the optimized attachments from Invisalign and use I don't accelerate or decelerate generally. We go with the amount of movement per aligner that is accepted and standard for these cases. However, we shorten the intervals. So for Amanda, we're going to put her at 3 days. So 18 aligners, 3 days, you do the math, that's 51 days. So of course, for this, you need a pretty incredibly compliant patient. You need micro-osteoperforation, and you need high frequency vibration. So away we go. Right away, the day we deliver the aligners, we also perforate her. And generally in the maxilla, we use 2 perforations in a column between each root that we want to accelerate. And each column is about 2 to 3, each of the perforations is about 2 to 3 millimeters apart. In the anterior maxilla, we go in about 3 millimeters. In the posterior maxilla and the posterior mandible, we're closer to 5 millimeters. And on the hand-driven device, there is some graduations, which will show you how deep you are. And on the rotary device, we kind of eyeball it as we go in and out. In the lower anterior, we're generally only 1 between each root. I think sort of historically we used more than enough micro-osteoperforations, and we've learned since then that their halo of effect is really a good size, as in a diameter of about 8 to 10 millimeters from where you do the perforation. So you don't necessarily have to do a whole bunch of extra perforations, nor do you have to come in from both the lingual and the buccal. You can feel comfortable with that actual perforation having a pretty good little bubble of influence. The effect lasts about 4 months altogether. So in Amanda's case, with 18 aligners, 51 days, we're only going to need 1 round of this with the micro-osteoperforation. And she's going to use a high frequency vibration device for 5 minutes every night. 51 days, we got to here. So from there to there, and this took, of course, excellent compliance. It took micro-osteoperforation, and it took high frequency vibration. So very routine in our office for us to use this as an acceleration technique. It's reliable and it's predictable. And it's patient friendly. You know, it's sort of cute because there's a reason why most specialists went into orthodontics, and that is to avoid bodily fluids. But it's actually surprisingly not all that painful, nor is there like a great deal of hemorrhage and that sort of thing. So it actually still keeps us happy, despite the fact that we went into orthodontics for a reason. Very cost effective, and not just sort of the cost of the devices themselves, but of course what they save us down the line as well. Very few postoperative complications. We have our patients rinse with a chlorhexidine rinse for 3 minutes before the procedure, and then for 3 times a day for the 3 days following the procedure. And I have not had a case where the little perforations have got infected. Very applicable to many movements, and we can be thoughtful about this, as in make the micro-osteoperforation go in a certain direction so that we can use it for like anchorage control, and we can use it to encourage movements in certain directions but not in others. All those sorts of things one can do in order to maximize the potential advantages of micro-osteoperforation. So very mainstream in my office now. A little bit of the science. What it does is we temporarily injure the bone, and that causes a cascade of cytokines, which of course recruit our favorite cells, the osteoclasts, and this increases the rate of bone remodeling and temporarily decreases bone density. So when we talk to our patients about it, we say we're going to soften the bone, thus making the tooth movements happen much more readily. So of course we have our x-rays handy. We try and avoid things like mental nerve and other landmarks, try to avoid roots as well. We have a little chlorhexidine rinse before, and there are different ways to anesthetize for the micro-osteoperforation. I prefer actually a little local infiltration. There is a profound topical anesthetic that a lot of my colleagues use, especially in the United States, but actually prefer to freeze them. And but you don't have to like freeze them into next week or anything like that. And away we go. So this is what the power driver looks like. And you know, people say, "Oh, gee, you know, that looks like my cable handpiece," but I encourage you to really stick with the proprietary stuff, because it is what has been studied, and it's important and it's different. And in particular, this device has a forward and a reverse, and it's governed very carefully to a low RPM. And one of the big enemies of this effect would be heat. So important that along the way, we don't heat things up too much. And we'll talk a bit about the burr itself as well and why it's important also. So here's my friend Thomas Shipley from Peoria, Illinois, and he's got it down to a science with his team member. And basically, he's hitting the power button, and he's letting her know when he's done, and she reverses it and backs it out. And then he moves on to the next spot. She puts it into forward, and away he goes. And you can see that he's putting thumb pressure on the head. Don't need too much. Actually, this thing is kind of self-propelling. And you can actually feel what you're in, as in you'll feel it in the soft tissue, you'll feel it hit the cortical bone, and then you'll feel it hit the cancellous bone. And it's into the cancellous bone that you need to go, although not that far, in order to get the effect that we want. You can see he's doing a couple in a column between the maxillary teeth, and he's watching carefully to stay away from the roots as well. If you do hit a root, you'll know it. We've actually looked at that in the TAD world and decided that it really does not cause a great deal of long-term harm. But of course, we do try and avoid it. Thanks again to Dr. Shipley for allowing me to use his video. So, you know, there is other ways to accelerate and to assure ourselves that these orthodontic movements are occurring, but I really try hard to make sure that things that I'm talking about and that I'm actually behind have some good science. And of all of the devices that are out there in the acceleration and vibration world, Propel, I think, has done the best job amongst all of the purveyors of these sorts of devices. And Isaac Newton and I are good friends as well, on Facebook as well, interestingly. And part of the reason why I'm so confident in the science is that it has come from a serious set of scientists at New York University, and Manny Alicani and his group, I think, have done a really nice job of studying this and making sure that it works and that it's predictable and it's reproducible, which of course are the landmarks of good science. The original study, a lot of you have seen it. Basically, they had a split mouth study where they were closing space on both sides with the same amount of force and the same mechanics. On one side, they used micro-osteoperforation, and on the other side, they did not. So tried to control most of the variables, except for the micro-osteoperforation. And you can see on the perforated side that canine moved considerable distance more than the canine on the other side. The other cool thing, of course, is we can get up near the center of resistance of the tooth, which we all know is about 2/3 of the way up the root of that tooth. And no other acceleration technique can actually get its effect that high on the teeth. So it's kind of neat that we can do that as well. Of course, along the way, there has been detractors, and scientists are not afraid of that. But there's one thing I want to caution a little bit, and that is to not just accept these other studies. Maybe have a good look at some of the methods and materials that they used, and make sure that we're doing an apples to apples comparison. For instance, in June 2018, there was a study from the country of Jordan published, and in it, they did a three-dimensional assessment of micro-osteoperforation on the rate of tooth movement and with canine reduction in a randomized clinical trial. So very good. Yes, sounds good, and absolutely we should look at this. They concluded that the 3 micro-osteoperforations did not accelerate tooth movement. So, okay, so that hasn't been our experience clinically. So we are motivated to go in and have a look at this study and make sure that that everything is copacetic. So here we go. We had a look. Oh, wait a minute. 3 MOPs were performed using mini screws. Interesting. Okay, so let's think about that. Mini screws are meant to go in quite peacefully, right? Into bone and anchor themselves in the bone and be useful for anchorage while they're in there, but not be terribly disruptive. So the use of a mini screw for this study, we would actually expect it to not do what the Propel device will do. The Propel device, we want it to go in there and really cause some disruption. We want it to hit the cortical bone like a stone would hit a windshield and cause a series of microfractures. And that's what gives us the maximum cytokine reaction that we're after. A TAD should not do that. And if it does do that, the TAD will likely fail. So interestingly, they tried to use TADs as a synonym for the Propel device, and the answer is not so. These TADs, of course, are designed to go in deeper as well, and they are different. So a lot of people ask me, well, why don't I just use a round burr or something like that, or even a TAD? And this is the answer. The answer is it does not give you the same effect. We want that. We want those radiating microfractures. And it is in the design of the Propel burr. So you can see there's a special thread in the Propel device that causes those micro cracks. And then in TAD, we actually want it to go in smoothly and without a whole lot of disruption. So there's quite a difference between the actual Propel device and the TAD. So we're getting faster tooth movement. We're getting accelerated bone remodeling. We're getting increased cytokines. It's very well tolerated. It's root protective. We get a transient decrease in bone density and therefore aligner accuracy. So let's look at each of those, and we've actually studied those. So I want to make sure that you understand that all of these things we don't just say. It's actually well tolerated. Here's an example: 30 minutes post MOP. You can see that the little dimples are almost gone. Now we know the effect is going to be around for about 4 weeks, but it actually goes away rather quickly. So these things heal over quickly, and we make sure their patients keep them clean while we're waiting for that. Here's a case of mine, another lady that is in a rush. Deep bite, of course, we pull out all of our special protocols for deep bite cases with clear aligners, and they include things like pretty robust attachments. We use the horizontal bevel attachments. In her case, there was a rotated lower second premolar, so we're going to put a button there and run a little power chain back to turn that tooth. And by the way, she's in a hurry, so we are going to go 36 aligners at 3 days a piece, and we're going to make this happen fast. So you can see the over-engineering that's occurring. We're putting extra palatal root torque into those upper incisor teeth, and we're going to use micro-osteoperforation all around basically all of the teeth, upper and lower, to get that kind of an effect to occur at 3-day intervals. And we're going to follow it up with our high frequency vibration as well. So here's what the little dimples look like that we do right away. And you can see that there's little bleed marks where they were placed, and they're down here between the incisor teeth as well. There's our power ridges, and you can see we're going to use some class 2 elastics here, and can't quite see, but we've got a little button here as well that we're going to use to derotate that lower second premolar. So that's what it looks like immediately after the micro-osteoperforation has occurred. And here we are, 3 days each, 36 aligners. So obviously in that velocity, we do expect some trouble with posterior open bites. We're very used to that, and we're able to over-engineer it in the case refinement. But we also know that the effect of the micro-osteoperforation has now come and gone. So here we are with the extra torque now that we're putting in, and we're way overdoing our deep bite correction. But we still want it to be very effective, so we're also going to perforate again. And in this case, we're only going to perforate the anterior teeth. So away we go. And this case is still underway, but we're going to finish her up in a good amount of time, and we're going to get rid of that deep bite. The high frequency device, the frequency actually matters, and we've looked at that carefully scientifically as well. There are a number of vibration devices out there that, but the actual vibration is important, and there's been a fair bit of research on this, and been an interesting little side effect as well that I'm going to share with you. So physically, we're getting mechanical aligner seating. So basically, we're vibrating the aligners to sit down better over the teeth. Very superior over low frequency vibration under bite force. If for whatever reason there has been not great compliance and the patient wants to get back on track, this is a good little device to have in your back pocket for that sort of thing. And we're using it during retention as well, and I'll share with you a couple of applications in retention. Clinically, we see a decreased bone density with orthodontic force. We see some catabolic effect when we're putting force on the teeth, such as with aligners or braces. But we're also seeing an increased bone density without orthodontic force. So what we're saying there is once we actually stop moving teeth and we want them to stabilize, there's an anabolic effect as well. So we actually have our patients hold on to these devices even after we're done, and they can use them long term to help with this anabolic effect, and also to actually go ahead and have that available should there be a little bit of relapse as well. So kind of neat that these things last for a while. Increased bone preservation following extraction. So you can imagine the frontier for this device is going to be interesting. And increased and prolonged osteoclast activity. So that's on the catabolic side, but also we're getting fibroblast proliferation in order to help us stabilize these teeth, and therefore that leads to osteoblasts, and the bone gets of higher quality once we've got the teeth where we want them. So kind of neat. Overall, what we're after, and this is where the rubber hits the road, we want improved aligner accuracy, and you can dial in all you want into these aligners and do your very, very best. But the key is have the aligners track and make sure that all that magic you put into your aligners expresses itself. Therefore, reduced refinements, and we're aware that my accountant once again gets after me about refinements too, because it's another scan and another visit and all of those things that he doesn't like very much. Increased rate of tooth movement, we're aware of. Reduced treatment times, absolutely. Been some interesting data as well on reduced orthodontic discomfort. So we find that this device is the patient's best friend the day they go into a new aligner or when we adjust their braces, and improved bone quality at retention. And we really looked at this. I think the root resorption, of course, when we talk about acceleration or moving teeth more profoundly, the question will come up, okay, well, is that going to hurt the roots? And the answer is really not. And the reason is because we're affecting the bone and while we're moving teeth, we're causing the bone to be softer and more and less resistant to tooth movement. So physically, we see this case where the patient's in pain, they got poor seating, and so we actually want to give them the V-Pro because we know that it's going to help with those sorts of things, decreasing pain, seating the aligners, and we get the patient the V-Pro. They're back 2 weeks later and get their attachments, and the aligners are well seated, and the patient's happier. So kind of a neat little device to have for those sorts of things, for sure. How about getting retention back on track? Absolutely. We've got a non-compliant patient with retainer wear, and there's some relapse. You see a lot of this, for sure. They try and put the retainer in, and it's just too darn painful. So instead, what we do is we gradually get them to try and make their retainer fit, along with the high frequency vibration, and that is provided to them to get them back on track. So kind of neat that we don't have to, start again with another round of aligners, or this is much more cost effective as well for the patient. And we have had some nice success with this. So here are the trials that have shown us why the frequency matters. And basically, the high frequency does have an advantage over lower frequency products. So, and that has been proven at the cellular level. The other cool thing that had been discovered was this is the idea of not just a catabolic effect, but an anabolic effect. So when we're trying to move teeth, it makes it happen faster and more assuredly. When we don't want to move teeth anymore, it helps the bone quality improve and the bone density improve as well. So kind of a neat sort of double hat that this thing wears. And you can imagine now the next frontier is going to be in things like implants and bone augmentation. And I honestly think that this sort of technology is going to help us with that sort of thing going forward as well. So basically, during active treatment, we're getting decreased bone density, and that's because the cytokines are being recruited from the compressed periodontal ligament. And in retention, we get increased bone density via mechanical stimulation. So kind of cool that this device can wear both hats depending on what we want when we want it. Improved aligner accuracy, this really makes things predictable for us with the V-Pro device, and that has been shown quite nicely for us. Reduced refinements as well, and of course, that makes everybody happy, patient, my team, and of course that annoying CPA of mine as well. And in a lot of these cases with the V-Pro, we have been going to 5 days. And as you saw in the combination V-Pro and micro-osteoperforation, we're going to 3-day intervals as well. Reduced treatment time, of course, that adds up to considerable time savings as well. And basically, in this study, the patients were instructed, hey, just go to the next aligner whenever you feel like it's passive. And in a lot of these cases, it ended up that was around 5 days. And here's that study that showed the improved bone quality at retention. So after we move teeth, we want to make sure they stay there. We're going to increase the bone density, and that's going to help us make sure that the changes that have occurred remain. So basically, high frequency vibration, we had a statistically significant increase in bone density at the completion of orthodontic treatment. And that one's fairly recent and also pretty darn cool. So most of my cases now in my offices are a combination of micro-osteoperforation and high frequency vibration. Certain cases we use only high frequency vibration. Almost always we never use micro-osteoperforation without following up with high frequency vibration. We just like the synergy that occurs between those two techniques. So you can make your cases very profitable at this with fewer visits, fewer refinements, fewer aligners, and happy patients, obviously. Become known as a fast finisher, which actually in orthodontics is a good thing. You can change up appointment intervals, and we tend to give our patients a lot more aligners these days. Each of our boxes, if you're using Invisaligns, aligners have about 16 aligners in them, and we often give our patients 16 at a time. Of course, sort of practice management wise, we think about this with regards to our patient contracts and the length of the contract and the amounts. And so obviously we're going to finish faster. We want to recognize that with our contract lengths and the amounts that they're paying. Of course, we encourage payment in full in advance because that eliminates that sort of concept of the patient counting on how many visits versus how much they paid, which is a human thing. So we give considerable appreciation to people who will pay in advance and eliminate the money from the medicine. We also continue the monthly payments in retention as well, and we see our patients in retention. And so it isn't really much different from active treatment time. So it's okay if they want to spread their payments out further. We'll go into the retainer period as well. So that's great. We're doing that a lot with acceleration, but in my offices, it's actually now becoming more and more useful with the micro-osteoperforation and high frequency vibration to get myself out of trouble. And I seem to be one who attracts trouble. And part of it is we do a lot of really, really tough cases, and we get referrals. Sometimes cases that are in trouble, and the practitioner wants some help. So quite often the situation is the tooth's just stuck. Now, pure ankylosis in the absence of a genetic problem or a severe trauma is actually quite rare. So it's more likely that there are these ledges of bone impeding the movement. And so right away, of course, the mechanism of micro-osteoperforation makes sense to address this if we're literally softening the bone then we're going to get these little ledges out of our way as well. So here's how it happens. Of course, the micro-osteoperforation leads to a localized area of inflammation that recruits our osteoclasts via that little cytokine cascade, and the osteoclasts resorb bone. So with this, of course, we encourage our patients, if they are a little sore, to not use anti-inflammatories afterwards. We generally stick to the acetaminophen as opposed to Advil or Aleve. And usually they're not in that much pain anyway, but generally we want to avoid anti-inflammatories with this process. We decrease the bone density temporarily, and this frees up the bog teeth. So here's a case where we had some difficult movements that we ran into with aligners. Sometimes if you want to anticipate this and you're using Invisalign, you'll know in advance. This little TMA drop down will actually tell you how difficult movements are. They use kind of a ski hill idea where there's going to be green runs and then the blue intermediate runs and some black diamonds as well. So if you're sort of unsure where you may need micro-osteoperforation and you want to be a little selective about it, that's kind of a neat way to find spots that it's going to be needed. So here's Nandi. She's a pretty tough aligner case, nice facial profile, but she's got a anterior open bite, she's got a narrow maxilla, and she's got forward tongue posture. So you can imagine part of this is going to be simply retracting these teeth, thus making them taller relative to each other, and therefore establishing some overbite. Along the way, we're going to talk to her about her tongue and that sort of thing as well, and make sure that it gets out of the way as an etiology of her anterior open bite. So away we go. We started this case without micro-osteoperforation, just sort of straight up retraction and a bit of intraproximal reduction, as you can see there. And we got this case going pretty well. And Nandi was a good patient. Each of these were at 1 week intervals, so 21 aligners, and we got to there. So you know, I was talking to my patients about that there's always at least one tooth that's going to act up, and we talked to them about the little ballerinas that are all lined up in a row, and then the one ballerina that's hanging upside down. So when we see this in our aligner cases, we like to think of a fair number of 3-letter acronyms. So I did this presentation once live, and a dentist put up his hand and he went, a 3-letter acronym, WTF. So that could be one of them that you might think of. But we also think of other 3-letter acronyms, including IPR, and of course, including MOP and HFV. So interproximal reduction, free those teeth up. Micro-osteoperforation, soften the bone. High frequency vibrations, seat the aligners, and keep the effect going. Of course, we're going to change up our attachment regimen on this tooth as well to try and get a little better grip on it. So let's see if we can get that little ballerina going. We've got a new attachment on the lateral. I was having a little trouble with the lateral on the other side, so I decided to perforate on that side as well. You can see how the micro-osteoperforations can be very localized, just according to where the trouble is. And here we are 3 months later with the micro-osteoperforation and the high frequency vibration. We got to there. And then finally, in a total of 16 months, we got to here. So from there to there at 9 months with the little troublesome tooth, add in all of our little acronyms, and we got to a nice result with Nandi. And now we're holding. So Sherry, this lady was transferred to me because the dentist was struggling, and of course it's quite often lateral incisors, and you know, everything was going not too badly with this case, except for an upper right lateral incisor. So the other thing that we think about with these cases is trying to create enough space first. Sometimes if you're not careful with the clean checks, you'll see them try and move that tooth right away. But we say, hey, do not try and move that tooth until they've actually got space. Give me 0.3 of a millimeter on either side of that tooth. We'll isolate it totally before you try and turn it. And we find that that does, A, it unbinds it from its neighbors, and B, allows the plastic to get up there and grab that tooth. And of course, I always refer to my other good friend on Facebook, Albert Einstein, and his famous quote about not trying the same thing over and expecting a different result. So thank you, Einstein, for keeping me from going insane. My hair is starting to look like his too, actually, at this moment. Thus the no webcam on this webinar. So away we go. We are now micro-osteoperforating in two perforation columns, each 3 millimeters apart on either side of that root of that troublesome tooth. And we're going to follow up with high frequency vibration for 5 minutes each day. You also saw down here there was a canine that was lagging, so went after that one as well. In both these cases, we asked the technicians, hey, don't try and move those teeth until we got space on either side. So away we go. And you can see 3 months later that finally, we're getting some results from those two teeth that were so troublesome. So 4 months after a lot of trial by the previous practitioner, with the addition of the micro-osteoperforation and high frequency vibration, we managed to get her back on track. So literally back on track is what we're after. We also use it with braces. I mentioned that a couple of my offices are aligners only, but we like it also with braces. Here's a young lady with some pretty darn impacted canine teeth, and we just know she's going to be a long and tough case. So we set her up, get her up into some pretty big arch wires, and create some space for those canines to come in when they are exposed. And then we send her off to the oral surgeon, and we have them exposed. The surgeon bonds the eruption chains to them, and then we use open coil spring as the engine to bring those teeth in. This is one case where we use micro-osteoperforation on the lingual. I think that if we did it on the buccal in these cases, especially since a lot of these canines are quite palatal, we can see that from our 3D imaging, we try and get closer to the problem. So 6 months later, here we are, we've got the left one totally down and the right one's on its way. We will have the patient help us out with some little box elastics along the way, keep the system active. And of course, she's using her her high frequency vibration on a nightly basis as well. So here we are, 9 months post MOP. We only did that once with her, but continued with the high frequency vibration. You can see that we identified a Bolton discrepancy with small upper lateral incisors, and we're intentionally leaving some space around those teeth for dentists to widen them. And so we got from there to there with the help of micro-osteoperforation and high frequency vibration. Finally, we're using it with retainers, as mentioned. This is Will, and Will was typical 16-year-old male, got through braces, had a beautiful result, and then stopped wearing his retainer, much to his mother's chagrin. So Will and I had a little discussion, and as opposed to having Will thrown out of his house or totally disowned by his mother, I suggested that if we kept the same retainer well and added in high frequency vibration for 5 minutes a day, and you wore this thing all the time, the retainer, I mean, you can do this. So Will was sort of in agreement with me enough and afraid enough of his mother that he decided to commit to this program. And in 4 weeks had those retainers incredibly well seated. So it's kind of an alternative to starting from scratch again with these cases and remaking all of the devices and backing up and that sort of thing. Stick with the same retainer, add in high frequency vibration and all the good things that we know it offers us, aligner seating, pain management, and the bone remodeling, and you'll get back to where you belong. So from there to there in 4 weeks, and Will is able to move back into his house now. So I'm not alone in enjoying having micro-osteoperforation and high frequency vibration in my practices. And there's a fair number of people who really like this and are large users of it in their offices. So I'm not alone, and I have a fair number of good friends and people that whose judgment I really trust, that are also using these devices in their offices with great success. And so you may recognize some of the names in there for sure. And as well, it's in universities. And so I think that's a pretty good, also a pretty good feather in the cap for Propel, in that universities, of course, try not to accept things until they have some good science behind them. So what the things that I want to have you take home from this hour, and of course I'll get to your questions right away as well. Acceleration of orthodontic movement with micro-osteoperforation has some really good science and now some good time behind it as well. So we're pretty darn confident that it actually works and it's reproducible. High frequency vibration is showing a nice synergistic effect along with the MOP. So as mentioned, in the vast majority of my cases, I'm using a combination of the MOP and the HFV. We're now utilizing MOP and vibration to make tough movements less tough. So it's not just acceleration, it's also useful reactively in getting me out of trouble. And finally, the high frequency vibration in retention has a nice anabolic effect. So we're actually improving the bone quality after we get the teeth where we want them. And that's pretty darn exciting as well. So if you feel that this might be for you and want to give it a go, I suggest that you head to Propel Ortho, their website. They have some great information on there, great resources. And you can click on Become a Provider. They'll also put you on the map if you are a provider and help get patients to come your way. And there's lots of great information and resources on there. So I am absolutely and totally grateful for your attention this afternoon. I know it's kind of an odd time in history, and a lot of you are wisely using this time to improve your knowledge of orthodontics, and I applaud that and thank you for your attention today. I will now turn my attention to your questions, and as well, please be reminded you will get a email shortly with your continuing education certificate. So thanks again for your attention. And those of you who wish to stick around, here come the questions. So the first one is from Daniel Souza Pinto Ramos in Brazil, and he sends hugs. Thank you. Absolutely, Daniel. Good to see you here. Thank you. Daniel also is quite a great user of Propel. So Chris Lee has asked me, can you compare this to Accellident? So, we try not to be too sort of, proprietary about these sorts of things, but, and of course I have been Accellident user in the past as well, but my issue with Accellident, and this is my opinion and not anybody else's, it's not the correct frequency. So when you saw that sort of low frequency study versus high frequency, the frequency does indeed make a difference. Accellident takes more commitment, as in 20 minutes a day as opposed to 5 minutes. We find my patients anyway, about 5 minutes is the most I can seem to get out of them. And it's expensive as well. I find that Propel has worked hard to keep their devices reasonable, and therefore a little bit easier on the pocketbook, and especially if you want to use them reactively and kind of give them away to help the case along. it becomes much more reasonable than if you've had to purchase the OrthoExcel device. And then finally, OrthoExcel has a kill switch on it. And I get it, you just don't want people to be done with them and then sell them on eBay, but Propel does not, and their devices will last for a long time. And as you saw, we have our patients hold on to them into retention as well. A few of you told me along the way, thank you, Alexander, Simon, that I lost the screen, and I'm sorry about that one little glitch with those videos. And a few people actually came back and said that it was working again, and I really do appreciate that. Thank you. We'll fix that for the future. Question from Bernard Schwartz. Can MOP be used with bony exostoses and tori? Fascinating question. Absolutely. So the micro-osteoperforation is indeed a kind of a bone softener in the vernacular. That's what we talk to our patients about. So the answer is absolutely. We do use it in heavy bone patients, and you know the ones I'm talking about, where their teeth are worn down and they're like these pieces of glass and concrete. So we have had some nice success in cases where the bone is particularly dense, and the action of MOP makes sense in those cases because it literally softens the bone. Dr. Schwartz, thank you. Oliver Favalli, my good friend, what has been your experience with using high frequency vibration without perforations? And the answer is we have, and maybe a little more recently as more science has come out with high frequency vibration. And also, especially if you're a little squeamish about poking holes in people. The answer is yes, there is indeed some usefulness to the high frequency device without perforations, and they include aligner seating, the decrease in pain, the decrease in bone density, and of course later on that nice little anabolic effect to help the bone quality once we're there. How does it work with MA phase cases? So I think you speak of the mandibular advancement system, Steve Corson, and the answer is with mandibular advancement, I am generally not doing that in non-growing individuals. So micro-osteoperforation is applicable mostly and effective mostly in non-growing. Correct. Let's start again. Mandibular advancement is most useful and applicable to growing individuals. We are using micro-osteoperforation and high frequency vibration mostly in non-growing and adult individuals. I have used it in a growing individual where the teeth are stuck, but generally for acceleration, we don't really need it because the kids' cells are so busy already. So really not a big usefulness in the mandibular advancement system, but we do use it a lot with Carriere, and we're in our class 2 Carriere motion cases. Thank you, Steve Corson, for your question. Shauna Basil, thank you for being on today. How long do you have retainer wear all day after treatment? When there is a rebound, do you have them return to wearing the retainer, or just at night? How long do they use high frequency vibration? So 3 questions there. Shauna, the answers are, we have our patients, generally the good ones, wear the retainer full-time for 6 weeks after we're done, either with aligners or braces. And then we go to night times only after that. We usually see them at 6 weeks and make sure that the retainers are seating. If not, then we have them continue with full-time. When there's rebound, do you have them return to wear the retainer all day? The answer is yes, we do. So we get them going with the high frequency vibration. We do IPR to make some room for the teeth. We remotivate them and we have them go back to full-time wear, but also with the vibration 5 minutes a day. How long do they use the high frequency vibration? So the answer is, in retention, it can be used pretty long term. We use it sort of episodically, meaning we say to the patient, hold on to this thing. If ever you see your teeth starting to wander, or if you feel some odd feelings, or if they're starting to feel painful, recommit to your retainer and hit it with the high frequency vibration. And that'll help stabilize things and make the bone denser as well. France Gascon, thank you for your question. There's the 16 aligners without seeing your patient. How do you know the teeth are tracking? Uh, and that's a great question, Branson. Thank you for that. A lot of our patients, you see that my offices are far apart from each other. So we teach our patients very carefully when we first get the aligners what a well-fitting aligner looks like. We actually send them home with pictures of what a well-fitting aligner looks like. Um, we have our sort of own kind of dental monitoring system, which isn't really dental monitoring, but it basically is, if we see some daylight between your aligner and your teeth, stay with that aligner, don't keep moving, and send us a picture. So other patients are really good now with mouth selfies, which they already are because they run Snapchat and TikTok already. So for sure, send us a picture and we're going to advise you. And usually what it is don't go to the next aligner. Make sure that thing seats with your vibration device. And if you don't, if it's not happening, then come on back and see us, and we'll sooner than we would have seen you. If you do need some IPRs, they're all done at the beginning of treatment. France, the answer is not always. We try and do it in a certain time, meaning that either if I can get at it right off the bat, I will. And then we'll also do it sort of at week 16 as well. You can put that into your ClinCheck so that you're going to see that patient that day. Sometimes you really want to unravel the teeth a little bit before you do interproximal reduction. So we set it up like that. Steve Corson, with palatally impacted canines, can't the oral surgeon do them up? The answer is yes, Steve. So there is kind of a cytokine type effect that we're going to get from the initial surgery, but we also know that that effect too is going to wear off. So you saw that case where we mopped her. That was after a good 4 months of already tugging on that tooth. And we know by then the sort of mop-like effect of the surgery itself will have worn off. So great question, Steve. The answer is the neurosurgeon really does do a little bit something like that in the act of exposing those teeth. Is the 5-minute session, Bernard Schwartz, of high frequency vibration done with the aligner in or out? And the answer is it's done with the aligner in, and that gives us that best effect that we want for the aligner seating. Oliver Favali, have there been studies of patients using high frequency vibration for 5 minutes more than 1 time a day? And the answer is yes. We've looked at various intervals during the day, and the answer keeps coming back. Anything more than 5 minutes doesn't seem to make a statistically significant difference. So therefore, it's really not useful. Now, we don't discourage patients who like it, especially for the pain part. And if they actually want to use it a little more often, I don't think you're going to do any harm, especially during the active part of treatment. But 5 minutes seems to be the magic number. Jo Beth Malero, hi. Is it covered with insurance? If it is, which code do you use? So, Jo Beth, yes, we have had a little bit of success with insurance with the micro-osteoperforation, not with the high frequency vibration. It kind of depends on your fee guide a little bit, but it's in the alveoplasty section of your fee guide. So please ask your Propel rep in your particular jurisdiction, and they'll tell you which codes and how to bill insurance. We've been a bit hot and cold with that, but good luck with that. Jeffrey Hood, when using MOPs, do you need the MOPs on all the teeth in patient's mouth, or you can do MOPs on only the teeth that need the bigger movements? And the answer, Jeffrey Hood, is absolutely. You can localize it to where it is needed the most. Teeth that are going to move easily, or they don't have that far to go, or they don't have complex movements, you really don't always have to go after those teeth as well. So we definitely localize our perforations just to where they're needed the most for the bigger and more complex movements. And sometimes I don't always know that in advance, and that's why it's nice to have it in our back pocket. Kareem Lalani, thank you. Great presentation, and cheers. Back to you, Kareem, for sure. John Simpson, thank you. I like the evidence-based references. I was not aware of the research. Thank you, John. And honestly, it has been a real big deal to me to make sure that things that I teach are based in science. Is there another company rather than Invisalign to use high-frequency vibration? So, Alcide, thank you for your question. The answer is that high-frequency vibration is produced by a company named Propel Ortho, who don't have a connection to any particular aligner or braces company. They are their own company. They're actually owned by a medical doctor. So that too helps us with the evidence base. So the answer is you can absolutely use it with whatever system you're using, be it clear aligners or braces. Thank you, Shauna Basil, appreciate it. Ala Alcede, again, which cases are most suitable for high frequency vibration? I generally find it most useful for clear aligner cases and cases that I know are gonna be difficult, or the bone is gonna be dense and troublesome. We really like it with deep bites because it gets that maximum seating and also the nice effect of the bone metabolism as well. So generally, pretty well any aligner case in a non-growing individual, and especially in deep bites and tough transverse cases as well. John Simpson has a philosophical question. Thank you, John. Why are dentists and orthodontists the only professionals that offer a value-added service and not feel the desire to charge for it? Okay, John, this is a great one, and we should actually have this discussion over a cocktail when we can finally get together again. You know, it has confounded me, absolutely. I think you know, my sort of my own approach to it is it's going to save me time and money because the case is going to go better and it's going to go faster. And I'm also going to be known as that guy, which is kind of a non-tangible as well. But I agree with you, actually. We give away so many things, and it's interesting that dentists and orthodontists have got to that. So let's meet for a cocktail, John, and we must have that discussion further. Great presentation, good info, very entertaining, and thank you, Shireen Lalani. And the final one is from Shireen Lalani. She actually wants to join us, John Simpson, for the cocktails, and the answer is absolutely. I look forward to that. So everyone, stay safe, stay apart. Check out propelortho.com, and if anyone wants to get a hold of me, info@icando.ca, info@icando.ca. Thanks again for your attention, and have a great evening.